Hello everyone, welcome back to my channel Anytime Medicine, and today we are going to learn about clinical correlations of glycolysis. So my previous video was about glycolysis, so make sure you check that video out first and after that you come back here. So before we start, subscribe to my channel Anytime Medicine so you cannot miss my future videos. So first thing we are going to see is alanine cycle. Skeletal muscle use protein for energy and they produce alanine in the process. Alanine will get into the blood and from that it will get into the liver. Liver converts alanine back into the glucose for making the energy via glycolysis. So that's how we produce energy in muscles. So there is a limited supply of NAD+ because it is been used in glycolysis steps that we have seen in my previous video of glycolysis. That's why we have to must regenerate NAD+ constantly in order to supply NAD+. We will produce NAD+ from NADH. If there is a O2 present in cells, it will go to mitochondria for TCA cycle in order to create NAD+. And if there is a O2 absent, it will go to the LDH, which is lactate dehydrogenase process that we are going to see next. So pyruvate usually go to TCA cycle. If there is not enough oxygen around, pyruvate will go to lactic acid pathway. In lactic acid pathway, lactic dehydrogenase will help pyruvate to convert into lactic acid. In this process, it will produce one NAD+ molecule. That's how we will get NAD+ molecule from lactic acid pathway. We will see high level of lactic acid in hemolysis, myocardial infarction, and some tumors. It will help to determine type of pleural infusions, like whether it is transudate or exudate by the level of the lactic acid in the blood. If there is high level of lactic acid in the blood, we will end up in lactic acidosis. In decreased O2 situation, pyruvate cannot go to TCA cycle pathway, so it will go to lactic acid pathway for making NAD+. So there will be high level of lactic acid in the blood and it will end up in lactic acidosis. There will be low pH and low bicarbonate too, because there is a high level of lactic acid, and that's why there will be increased anion gap acidosis. This is seen in sepsis, bowel ischemia, and seizures. In seizures, there will be hypercontraction of muscles, so they cannot use oxygen, so it will go to the pyruvate will go to lactic acid pathway, so there will be high level of lactic acid and it will end up in lactic acidosis. That's why we will see lactic acidosis in seizures patients. So what is muscle cramps? In excessive exercise, there is too much NAD consumption because there will be lots of glycolysis happening in our cells. Because of that, it will exceed the capacity of TCA cycle and there will be high NADH-NAD ratio too. This will favor pyruvate to go to lactic acid production, and because of that, muscle pH of the muscles will fall and it will lead to cramps. Disease pyruvate kinase deficiency is an autosomal recessive disease in which most affected cells are RBCs because they don't have mitochondria. They require pyruvate kinase for anaerobic metabolism. Without pyruvate kinase, they cannot generate ATP. That's why they will lose ATP. Because of that, they will lose integrity of membrane and it will form abnormal shape of RBCs. That's why they will be phagocytized in spleen. This is usually present in newborn with extravascular hemolysis and splenomegaly. In severity of this disease will range based on the enzyme activity in the cell. So next thing that we need to know is 2,3-biphosphoglycerate, which is created from 1,3-biphosphoglycerate by enzyme biphosphoglycerate mutase, which is used by RBC because they don't have mitochondria, as they cannot run TCA cycle and make ATP from it. RBC will sacrifice ATP from glycolysis for this reaction to occur because 2,3-biphosphoglycerate alters the hemoglobin binding to the oxygen in order to deliver oxygen to the tissue. So the sacrificing of ATP will work for RBC in order to deliver oxygen to the tissue. So last thing we are going to see is how much energy we get from one glucose. Highest ATP we get from glucose is 32 or 30 when there is mitochondria and oxygen available. 32 ATP we get in liver, in heart with the malate aspartate shuttle, and 30 ATP we get in muscles from glycerol 3-phosphate. Lowest ATP we get when there is no mitochondria, neither of oxygen. We get 2 ATP from lactic acid pathway. So thank you everyone for watching this video. If you like this video, hit the like button. Don't forget to subscribe my channel and share it with your friends.